Court Reporter with Stovall and Associates.
Welcome back to Court Reporter with Stovall and Associates. I'm your host, Mike Oglinski. Our second guest tonight is Mr. James OSCARSON. He's a candidate for the Nevada State Assembly District 36, and he's also the current sitting marketing director and ombudsman, for Desert View Hospital.
Correct. Thanks for having me, Mike.
Of course. Thanks for coming back. I do appreciate it. Actually, you know, one of the things I did just see is that you got an endorsement from the NRA.
I did.
Being pro-Second Amendment rights.
I did.
Well, there
I did.
You go.
I'm very proud of that, and that's a great feat for us to have, and we're very pleased that we're able to. They recognize that we do support Second Amendment.
It's wonderful. You know, and in this county, it's so important because you have people that really do believe in concealed carry and a lot of open carry here, too,
right.
actually. So,
right.
Anyway, so currently you have a very unique perspective, and something the last time you were on the show we weren't able to really discuss was the Affordable Care Act.
Right.
And it's something I kind of wanted to talk to you about, being that you have such 30-plus years maybe, I guess, in healthcare.
Right.
And now I am assuming you're probably doing your homework running for public office here. So
we are, and there's a lot of the Affordability Care Act is a 2,000-page document that I wish I could tell you that I'd read entirely. I wish I could tell you I believe any of the legislators have read it entirely. I think that there's turns and bumps and bruises and wrinkles that are going to come out of that whole legislative items that there are, and I think it's going to be there's going to be a lot of things in there that people aren't going to be very happy with.
Breaking it down is as much as we possibly can. Some of the root issues that I think that we've been able to pull out of this 2,000-page document, and I certainly haven't read it, and I think you're probably dead on. There's probably very few amount of people who have. You know, one of the things is going to be the expansion of Medicaid coverage for people that aren't currently receiving Medicare, and in
right.
fact, it's above and beyond what I guess what the poverty level would be.
Correct.
Currently sitting at a household income of about $18,000 per annum. People would actually be getting this benefit. Is this going to be a positive effect over the board or across the board for people in rurals? Because typically you're going to find a lower household income in rurals. Are you going to see a major effect here?
Well, an interesting component, we just did a health fair at the hospital a couple weeks ago. And one of the things we found, we immunized, I think, right around 300 kids. Of those, we kind of kept track. 54% of those people had no insurance at all. They weren't a part of any. 54% didn't have any insurance at all. They weren't a part of a immunization program of any kind. So all the services that were there were available to them at no cost. They might not have gotten otherwise. Immunizations included in that fair. So I do believe it's going to impact people. Although the hospital now treats anybody that comes in for care, so that's going to continue on. What's going to happen is it's going to obviously expand the Medicaid population of people, and how's the state going to afford to pay for that? And that's what Governor Sandoval is working on right now.
Okay, and one of the things I guess is the question of, again, how are we going to cover this cost, and is it in fact going to be a tax? Something that's become widely publicized, I guess, would be the employers having to subsidize or, in fact, offer health care benefits. And if, in fact, they don't, then they'll have some type of tax liability that will be associated with not providing that health care.
Right. And if they come to you and say, 5 or 10% of your payroll is going to be, you add that to your fee, to what you're paying us, and we'll cover your folks on with health care. I mean, what business is not going to jump at that? That's going to be it'll be a tremendous savings to the employer. The question is, what quality is that health care going to be, and what's it really going to include? And that's what nobody seems to be able to tell us.
So I guess what we're talking about now then, and of course I understand that you have, through the hospital, the emergency room kind of handles reactive care.
Right.
Is the major effect going to be on services as far as being preventative types of care, or just general practice where somebody might be able to walk in and say, hey, I think there might be something wrong with me, instead of going to the ER?
I think you're going to see the ERs get more and more busier than they have been in the past. I think that they're going to be using the urgent care and the emergent care more often than they have been in the past. What's going to happen, though, and that insurance will cover anywhere. We have people who are uninsured in the hospital that are there for for lengths of time for treatment, because again, we don't turn them away. There's no reason to do that. People deserve care and quality of care, and that's what we believe we offer. But in the long run, what's going to happen is you're going to see if physician groups and those kind of folks can't afford to treat people. If you've got a reimbursement rate that's below what it's costing you to treat people, it's not going to work. It's not going to happen. People aren't going to be able to stay in business. It can't cost me. I mean, and I'm talking about hard cost. It can't cost a facility $1,000 to treat somebody and you being reimbursed $400 for that service. It just doesn't work.
But again, what you're speculating then is hard costs associated with, for instance, having to employ a professional. Is it different from when you start talking about somebody that actually has a primary care practice they manage themselves? The hard costs aren't necessarily associated with keeping the lights on and prescribing or prescription pads.
Right.
Is it a little different from the institutional standpoint versus, say, the practitioner standpoint?
Really not. Really not. There's still hard costs associated in the if I'm understanding your question. There's still hard costs associated with a hospitalization, with a visit in the emergency room. You've got three different aspects of an emergency room visit. You've got an emergency room physician that's contracted and they have a bill. Then you've got radiology services that are contracted by another group of physicians. And then you've got the hard hospital bill. So you've got really three components to a hospital bill. All those come together, and basically when people are seeing the emergency room, they get three bills. So that's how it ends up working.
Is it fair to say that the way your hospital is currently operating, your institution, of course, is the only one you can speak to right now, you guys say you have an obligation to see people because they deserve medical treatment. Is this going to have an effect on your bottom line if you're going to see a larger influx, or are you guys going to be compensated at the same rate you're currently at?
We don't know the answer to that.
And why
That's
not?
exactly because nobody has been able to clarify that. There's a lot of speculation about how things are going to happen and what's going on, but I don't think that there's really a clear-cut definition. And I think a lot of this hinges, and you and I talked about this a little earlier, a lot of this hinges on what happens during the election. I think there's a lot of things going into place. Let's take EMR, electronic medical records, for example. Those are things that have to come into play. Whether the Affordable Care Act goes through or whether it's repealed or whether there's parts of it that are repealed, Supreme Court's made their decision on it. But what happens in the interim if you get a new president? What happens with some of those things if they're repealed or there's things that happen? But the EMR, for example, is a component of that really is making a huge difference. And the ability for me to, if you're in San Diego and you've been seen in the hospital in the ER or in the hospital in Pahrump, they can dial into a system and pull your records and know what we've done for you, what we've given you, those kind of things. That's a huge component of part of that process.
It's a consolidated clearinghouse for medical records.
Yeah, your medical records will be available to any provider that wants to see them at some point in time. And that's supposed to be, I believe that's supposed to be completely implemented by 2014, if I'm not mistaken.
Okay, so aside from the individual mandates, and in fact, there's even a penalty associated with that
there
if you
is.
can afford the health care, which I think I had somewhere in my notes is, at its current top level right now, we're seeing in 2016 it would be $695 a year, but then of course there's a built-in cost of living expense, so it perpetually will go up. Are we seeing though that small businesses in the district that you hope to represent, that in fact will be impacted by this? Do we see a lot of 50-plus employee businesses that aren't currently offering health benefits to their employees?
It's interesting. I've visited with a lot of business people, and this does not seem to be something that's on the radar at this point in time. I think, again, because they're waiting to see what's going to happen during that election period. Because you've still really got a year after that period of time that people are going to be discussing it and working on it.
2014.
Yeah. So you've still got a year that people are going to be thinking about it. And you know what happens? People wait till the last minute to make those decisions about what they're going to do, especially with healthcare. They'll probably continue on with some of the programs that they already have. I can tell you I'm on the board of one nonprofit organization in this community, and the insurance premiums went up at least 50%. For the employees. It's a very small group of people, but at least 50%. And that cost was shared by the organization, but the employees had to pay additional as well. So if this is really going to save money, it's yet to be seen.
Do you think that the what seems to be kind of a vogue trend as far as the expansion of managed care in communities like rurals, is this going to help to offset some of the patient flow if in fact this was ever to be repealed, which doesn't look like it's going to be? But are we going to be able to see or realize medical care that is sustainable without having the small businesses or individuals to really subsidize the majority of that cost?
I think what you see is you see more and more large insurers come to these communities. And there's a couple of them here in this community right now. And they're bringing specialty services to this community, which obviously increases the ability for people to not have to go over the hill to Vegas for services. And that's a huge thing. I attended a seminar a couple weeks ago where one of the hospitals in Las Vegas actually now has, it's called telemedicine. I don't know if you're familiar with it or not, but they actually have a robot that a specialist can drive from wherever the facility he or she is. They can drive that robot right up to the side of the bed. They can interact with the patient, ask them to do things. The physician can watch, for example, if you have somebody who's suspected of having a stroke, have them raise their arm, have them smile, have them do these different things. They can turn the camera and look at the screen to see what their labs are, and all those kind of things. They can look at lab results. They can there's actually a stethoscope attached to this thing that they can actually listen and monitor the patient. It's an amazing piece of equipment, and you're going to see, I believe, more and more rural hospitals in rural areas, especially in Nevada. The state's got some really good telemedicine kinds of things going on, and some of the private hospitals, the for-profit hospitals in Nevada, are really going to be touting these services to rural areas to be able to help them fulfill the need.
Okay, I was going to ask a question.
No, go ahead.
Well, to you, with using, say, robotics, are we losing the intangibles that the physician comes in to diagnose, say, for instance, a problem? Or
I don't believe so. You've still got a physician there. But what we're talking about is, in small rural communities, it's impossible to have a neurologist and a kidney specialist and a nephrologist and those kind of things. So those specialties, you're not going to replace a physician with a robot when it comes to general medicine and primary care things. It's not going to happen. What you're going to do is it helps assist the physician that's there in the emergency room in a rural hospital. In a big tertiary hospital, you've got all these different services that you can call upstairs and say, hey, could you have the nephrologist come down and see this patient? In small rural hospitals, you don't have that luxury a lot of times. So I think it's really a supplement to what we're already doing, and I think it's a way to cut costs and save some money in a lot of cases.
Very interesting stuff. I'm glad that I had you on because I wanted to talk to you a little bit about it. We're out of time. Okay. I appreciate Mr. OSCARSON, and good luck. Anything with your campaign that we can tell the viewers to help you or maybe volunteer some time? We're going to be looking for all the help we can get. The next 2 months are going to be very frantic. I just spent all Labor Day weekend up in northern Nevada. We went to Manhattan and Belmont and up into Round Mountain and Carver's, those areas, because those are all included in the area. We've got about 22,000 miles of area that we cover, and it's a huge district, the third largest in Nevada. Anything you can do to come and help, we're getting ready to do some different things that you'll hear about in the next couple of days, I'm sure, that will hopefully give you an opportunity to come and help us make phone calls and just do some door-to-door things, and we appreciate it very much. Thanks for being on tonight. We appreciate it, and good luck with your campaign. Enjoy it very much. Thank you. We'll be back next week with Court Reporter. Thanks again for watching.
Court Reporter with Stovall and Associates.